Yep, it's that exciting time of the year again, and as we move towards our 10th EuroPD, I guess we have a chance to reflect on what we've done in the last 18 years. We started out as a small meeting, a meeting which was designed to be a one-off to teach people about science in PD. Welcome everybody to the 10th EuroPD meeting. On behalf of EuroPD itself, its own organisation, and the local organising committee, it is my pleasure as the president of EuroPD to welcome you to this meeting in Birmingham. I think it's important that we understand a few things about EuroPD. We understand its heritage. This, after all, is our 10th meeting, not our 10th individual meeting, as I'll show you, but our 10th meeting in total. And to understand how something which was perceived and conceived as something very small, something very focused, something very scientific, maybe too scientific, has turned into what EuroPD is today. That is a multidisciplinary, clinical scientific meeting which focuses specifically on PD.
One evening in the spring, I heard a maiden bell so sweet for to sing. Her chain she rattled with her hands, and the sweet quiet she.
Charlie, what do you hope that the conference will achieve this year?
Well, I think the most important thing for me is that delegates from around the world, but particularly from the UK, who are my constituents really, get the best possible understanding of the advances in PD, how PD should be used in the modern era, and how to give patients an informed choice.
The NICE guidelines are only recently published. What effect do you think that will have on PD?
I'm hoping that in the UK, the NICE guidelines will promote informed choice for patients, and particularly that they will encourage professionals who may bring their own biases to the decision of which treatment to have, to give patients a proper choice rather than to impose their opinions on their patients.
Professor Ritz, your talk at this conference has a very interesting title, Is Better Better Than Good? What insights will you be sharing with us?
I was told that a major problem currently is the guidelines which we have to follow, which do have fiscal and legal consequences. And I try to give a critical evaluation how solid the footing of these guidelines is, how well it is supported, and how inflexible or how flexible we can be. I feel that being kept into a very strict cage of regulations is not leading to the best of medicine. I think that more individualization is necessary, and what is good for the one patient is not good for every patient. And I will try to give examples which hopefully will convince my colleagues that I'm not sacrilegious, but a thinking individual who does have specific complaints and proposals for changes in the guideline structure today.
Many of the delegates will know of Stanley Sheldon's controversial quote regarding PD as a second-class treatment. How do you believe this has changed?
First of all, Stanley Sheldon likes to be controversial and likes to speak strongly. He's not a soft voice. And frankly, I believe that in the early days, when Stanley and I were starting with dialysis, this to a certain extent was definitely true, because the techniques were much inferior. We didn't have the strict production qualifications that we have today. I think PD has a very important role in the management. Not that every patient should be going to PD. There are rules. There must be sufficient residual renal function. And I think the point where PD should be stopped is when the residual renal function has stopped. So I think it is stupid to say this patient should be for PD on his lifetime and this patient should go on hemodialysis. And we should not forget the third arm, transplantation. And it is ideal to have the patient who still have some residual function to go on PD, wait for a transplant, and if he gets anuric, put him on hemodialysis. So these are not alternatives, these are parts in a continuum.
And now we have some comments from Janusz Witowski and Michel Fischbach on the scientific programme of EuroPD 2011.
Janusz, we wanted to ask you about the basic science underpinning the EuroPD conference. What new data do you expect to be presented this year?
In the past year we saw many interesting papers on basic aspects of PD, and I think I would like to highlight two topics of particular importance. One is biocompatibility again, and the second is epithelial to mesenchymal transition of mesothelial cells. And the EMT became so important that we decided to organize a special seminar on this and to link the data to the issues of biocompatibility.
I know you're involved in the understanding of how fibrosis affects peritoneal longevity. Perhaps you could expand on that for us.
Well, it's not an easy task to summarize it briefly. We know that fibrosis and vascularization of the peritoneal membrane go together. And we know that from the basic work on EMT, that the process of EMT may be important here, because transformed mesothelial cells produce mediators that are important in fibrosis, in peritoneal fibrosis and vascularization.
Professor Fischbach, as a specialist in pediatrics, what do you think the important highlights will be at EuroPD 2011?
One of the most important events is adapted APD. This started by children and yet moved to adult care, and so with the same costs you improve efficiency of APD.
Can you convey the importance of biocompatibility in pediatric PD?
Of course. End-stage renal failure is an event in the life of a child, and so we need integrated care. And PD is one of the parts of this integrated care and should preserve all chance of life. So biocompatibility is essential.
The voice of the delegate from today's training session. What are you particularly looking forward to at this year's EuroPD conference?
The reason why I came here, okay, I'm a pediatric nephrologist, and I was invited to give a lecture here on the educational course, and I think that such a pediatric courses are very important to give the people the idea of what pediatric dialysis is, and I hope to contribute in some way to the better understanding of the situation and what adult nephrology should do to treat children like this.
You've just been to a training session here at EuroPD. Can you tell us a little about what you hope to learn from this session?
We just wanted to find out about any more recent revelations in the world of paediatric dialysis, anything that will improve our clinical practice and improve the our peritonitis rates and our peritoneal dialysis regimes.
Can you just give me a quick explanation about the session you've just come out of?
Yes, it was the pediatric nephrology session, and it was about catheter placement and selection of PD solutions and like optimizing PD dwell time, intraperitoneal pressure, and so on.
Okay, great. And you're researching, is that right?
Yes.
And what's your research area?
I'm researching about PD solutions. I'm investigating the biocompatible PD fluids, comparing the one with the lactate buffered and the bicarbonate buffered, and seeing if there's any difference in solute transport or near angiogenesis and stuff.
Okay, great, thanks. Have a good conference.
Thanks.
Thank you.